Hello, 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 Facebook. I am Dr. Myla Bennett of Adorabella Plastic Surgery and Medical Spa in Johns Creek, Georgia. Happy Memorial Day. So, many of my topics I get from scrolling around on Facebook and in some of the surgery groups that I'm in. And this topic I got from one of the surgery groups after I saw a post by someone who was questioning whether or not the surgery she wanted should be broken up into two operations or not. And then I saw lots of people commenting that she should get another surgeon because they don't have to break it up in two surgeries. And since that doctor was trying to make her get it in two surgeries, that it was just because they were trying to get more money. So I couldn't take it, so I decided to come on. I wasn't going to come on tonight, but I saw that and had to speak. Hello, everybody. Hi, Lisa. Hi, Sharon. Hi, Angela. Hi, Rachel. Hi, Carla. Hi, Melody. Hello, Ruth. You're welcome, Melody. Anderson, South Carolina, sweet. So for you all that are on with me, hi, Shamika. Go ahead and share the video and let people know that I'm on. Oh, thank you, Melissa. Hi, Dr. Valika. Hi, Kiara. So this is an interesting topic. I think it's an important topic because people inbox me asking me if it's safe for them to get. They'll like list the procedures they're planning to get and be like, "Is it safe for me to get this all at once?" So it's a really common question, and I think whether or not a person gets things all at once or not is a discussion that needs to be had between you and the doctor that you choose, because there's really not a right or wrong answer. It's really not a right or wrong answer to the question. It depends on multiple variables. I'm always bothered when I see some of the people's responses, and then I have to remember these, people are not doctors. They're not plastic surgeons, because even doctors who aren't plastic surgeons often don't understand the answer to that question. Or all the things that are in play to help come to the decision of whether or not it's a good idea to do multiple procedures at once. Sometimes it's a great idea, sometimes it's not such a great idea. Some of the variables that come into play is the health of the patient, which you should be in pretty good health if you're getting plastic surgery anyway. But if that's a factor. The number of procedures, where the procedures are on your body that you need done. Like if you have to be flipped, if the patient has to be flipped on the table and you're getting multiple procedures on one, in one position and multiple procedures in the other, all those types of things play into planning whether or not it's one surgery or two surgeries. But Melinda, okay, so you say I find it cheaper to do it once because of anesthesia. It's not cheaper if you die. It's not cheaper if you get some really bad complication because it shouldn't have been done together. So I really don't like it when people use cost as a reason to do certain things, because that's how folks end up in trouble. Like, I think that's the number one reason why people die from plastic surgery is because they're trying to make it be cheaper. If you can't afford to do it the safe way, you shouldn't do it at all. So, yes, from an anesthesia standpoint, it'll probably be cheaper. But if it's not a good idea for other reasons to do it, the cost should not be what makes you decide to do one surgery or two surgeries. That should be the very last thing on the list of considerations when making that decision. Dead last. Sometimes mixing surgeries, some combinations of surgeries are not a good idea from a complication standpoint. For example, I talk about this one all the time, doing a tummy tuck and liposuction of the central abdomen at the same time as the tummy tuck is not a good idea, in my opinion. in my educated opinion, because of the complication rate. It increases your complication profile dramatically. It increases your risk of necrosis. Everybody doesn't get necrosis when they get the two together. You don't know if you're going to be one of the ones who get it until you have it. It happens enough where I think it's not worth the risk, and the ramifications of it, if it does happen, are so great that I think it's not worth the risk. So there's a lot of plastic surgeons who won't combine the two. There's a lot of plastic surgeons who will. A lot of times when I explain that to my patients about why I don't like to combine the two, they don't even want them combined anymore when they realize what could happen if it goes poorly from combining those two procedures. So that's right. If you can't afford to do it the right way, don't do it. Like, it's not, because at the end of the day, these procedures are things that we want. It's not stuff that we need. So I think, your family would appreciate you being there with a big belly, as opposed to dead in a casket with a flat stomach. Like, that isn't. So you don't want to make decisions based on price alone. That should be like the last thing on the list of considerations, is the price. So the person that the post that I saw in the group was someone questioning whether or not they should, the doctor that they consulted with told them that they should get their circumferential body lift, or 360 tummy tuck, meaning your front gets lifted and tucked and the back gets lifted and tucked. And this is usually something that happens in a person who's lost a lot of weight. And so they'll have a lot of sagginess in the back, like on their butt and stuff like that. And so then they'll get they'll get a tummy tuck, and it'll be extended all the way around to the back to lift their butt and stuff like that too. And the doctor that this lady consulted with told her that they wanted to do it in stages, in 2 operations. And everybody on the feed was like, go to another doctor, pick another doctor. She's just trying to get your money, or I don't know, he's just trying to get your money, whatever the doctor was. They're just trying to get more money out of you. That is almost never the case when you're dealing with an ethical plastic surgeon. You don't make more surgeries to get more money. That's not how that goes. Not to mention, honestly, when I have people break up surgeries, it doesn't cost them more money from my standpoint. It just costs them more money for OR and anesthesia. And I don't get the money for OR and anesthesia. The hospital gets that. So me breaking it up doesn't benefit me. So that's not a motivation for me to do it, to break it up. But part of the reason why, in the case of a circumferential body lift, or circumferential tummy tuck, or 360 tummy tuck, or whatever you want to call it, it's all the same thing. Hi, Lori. One of the reasons why a lot of people stage it, a lot of surgeons will choose to stage it, is because you can actually pull the tummy tighter when you're not doing the back too. It's not about money. It's about outcome and result. So if you pull the back and you pull the front, you know how, like, when you get a tummy tuck, the ladies will be bent over, hunched over for like a week after, before they can stand up straight, because so much tissue is taken out to pull it nice and tight that the person has to be hunched over to even get it closed. Well, if you do all the way around, you can't hunch them over like that, because it'll pull the back incision open. So if you're bent over in the front, folded in the front, that's putting more tension on the back. So some surgeons will break it up in 2 so that they can get both sides tight, the front and the back. Yeah. So it's not about money. It's about outcome and result. And it's just, people jump to the worst conclusions. There are definitely some jacked up doctors out there. I was just talking about one last week. And some of the most popular ones for plastic surgery are an ethical hot mess. But most plastic surgeons, most real, board certified plastic surgeons are ethical people, and in general that's not the case. Like, breaking that particular surgery up gives you can potentially give you a better outcome, because your tummy tuck can be tighter, and then when you do the back can be tighter. Right. I'm located in Johns Creek, Georgia. It's a suburb of North Atlanta. So it bothered me when I saw those comments, like telling this lady to pick another doctor because it could be done together. Yes, it can be done together, but you're not as tight. And the whole point is to get nice and flat and tight. So, not to mention, this doctor sat there. This doctor knows the health of this patient. This doctor knows the anatomy of this patient because they've been examined by this doctor. And then all these random people in the surgery group are giving their 2 cents like they know everything about plastic surgery because they had a surgery done on themselves. That's not it. Like, they just know about their experience having had their operation, but that does not make them an expert in plastic surgery. It takes a whole lot of years to become an expert in plastic surgery. And, you know, with those things, it bothers me because people think they're experts because they had it. And if you think of your only experience with the surgery, you were asleep for it. So because you recovered from a surgery doesn't make you an expert on surgery. Because you went and got 5 consultations with 5 plastic surgeons doesn't make you an expert on surgery. If it was that easy, it would be a lot more plastic surgeons out there. Exactly. People give advice with no medical background at all. So if the doctor you choose or the doctor you consult with tells you, I think we should do it in 2, don't jump to the conclusion that they're trying to get more money. It's probably not the case. It's probably not the case. In fact, if they were greedy, they would rather get you all done in once because that's more people that they can service. If they just knock you out in one, when you have to go back and do another surgery on somebody, you know, that's time that you could have with a fresh new person. They could just do you all at once and be done with you and already have all the money they need from you. It's not about money.